We're going to go ahead and get started. Welcome to the 9th meeting of the House Standing Committee on Health Services. I think we have folks still rolling in, but DJ, if you could please take the roll. Get started.
Representative Bentley. Yes, sir. Representative Bratcher. Here. Representative Bray. Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Duval.
Here.
Representative Frazier Gordon. Yes. Representative Justice. Representative Neighbors.
Here.
Representative Rayburn.
Here.
Representative Raymer.
Yes.
Representative Riley.
Here.
Representative Rourks.
Here.
Representative Sharp.
Present.
Representative Wilner. Representative Whitten. Vice Chair Dotson.
Here.
Chair Mosier.
I am here. Okay, we have a quorum established to do business. We're going to go ahead and get started. We have a pretty hefty agenda today. The first bill I'd like to call is House Bill 170. Representative Roberts and Justice Keller, if you make your way to the table, introduce yourselves for the record and go ahead and proceed.
Representative Rachel Roberts here on House Bill 170. And
Oh, thank you. I'm not in my element here. Chairwoman Mosier, it's good to see you, and thank you for the committee allowing me to appear. And I'm here to answer questions, but not in taking a policy position, but I appreciate being here. Thank you. Michelle Keller from the Supreme Court.
Thank you.
Chairwoman Moser and distinguished members of this committee, thank you for the opportunity to bring this bill before you, a bill that will help cancer patients and those with disabilities throughout our Commonwealth. House Bill 170 is essentially a conforming language bill. It would bring our state law in line with federal law, specifically the Americans with Disabilities Act. The Americans with Disabilities Act was first passed in 1990 and was amended by the Americans with Disabilities Amendments Act of 2008 under then President George W. Bush.
Motion on the bill.
Okay, we have a motion and a second. Do we have any questions or concerns? Well, see none. I'm curious if you could just give a quick, tell us the story that brought this to your attention, and then we'll go ahead and take the vote.
I believe it was our opinion in the Joyce Turner versus Norton Healthcare case, which was rendered in 2022, and whether the KCRA is amended to adopt the federal ADAAA would not have changed probably what happened in that case because of factual issues. The court did alert the public at that time that it was unclear whether the KCRA fully embraced the ADAAA, which were the amendments that Representative Roberts just spoke of. So as a matter of staying in our own lane in the third branch and understanding that you as the policymakers would be the best voice to make that explicit adoption, we did alert in that opinion that we felt it was time to perhaps bring the KCRA in compliance with the ADAAA. And I can answer any questions.
Thank you. I appreciate that. We have one question from Representative Bentley.
Thank you, Chair Lady. The basis for this is from the Federal Civil Rights Act, right? Is that where it starts with?
It's actually the Americans with Disability Act that was originally passed in 1990 and amended in 2008, as Representative Roberts indicated during the Bush administration.
I must be reading this wrong then. Federal Civil Rights Act of 1964 is amended by Title 8 of the Federal Rights Act of 1968. Was that the grounding for it?
I think if you're asking about the Kentucky Civil Rights Act, the answer would be yes.
My point is, how many people were discriminated against until we brought this up today?
I'm not sure I can answer that with a specific number, sir, but I will tell you that I have brought this bill today because I think it is important for cancer patients and everywhere who have a disability but still want to be able to work within the state. And it is a conforming language bill, so this is simply putting us in line with the federal regulations.
Thank you, Chair Lady.
You're welcome. Okay. Seeing no further questions or commentary, we will go ahead and take the roll.
Representative Bentley. Representative Bratcher. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Representative Rourks.
Yes.
Representative Sharp.
Aye.
Representative Wilner. Representative Whitten. Chair Mosier.
Yes. Okay. House Bill 170 passes with favorable expression. The same should pass on the House floor. Thank you so much for bringing this, and it was great to see you, Justice Keller. Thank you for being here.
It was great to see you all. Thank you for your service.
Thank you.
Thank you to the members of the committee for support of this bill, and I would invite any of you to co-sponsor it who might like to. Thank you.
Thank you. Okay, we are going to skip ahead to Senate Bill 89 as the bill sponsor is toggling between committees. And I think we have some of the members of this committee doing the same. So Senator Funke Frohmeyer, if you could just introduce yourself for the record and have your guest introduce herself, and please proceed.
Thank you, Chairwoman Mosier. My name is Shelley Funke Frohmeyer. I'm a state senator from Campbell, Pendleton, Bracken, northeast corner of Kenton.
And I'm Mary Catherine Deloder with the Kentucky Birth Coalition.
We're bringing Senate Bill 89 to you today to recognize that there are women that are on Medicaid and they're pregnant. They're considering how to be maybe as holistically healthy as possible, and they're pursuing a more holistic home birth option. They are currently, but this would expand the possibility to use Medicaid coverage for a home birth. Right now it's available in a hospital-based birth, but this would offer that if you're going to use a licensed practicing midwife. I'm going to turn it over to Mary Catherine.
Thank you.
Motion on the bill.
Okay, we have a motion and a second on the bill. Do we have any discussion? Okay, we have a question from Representative Bratcher.
Yes, ma'am. I'm hidden over here behind this guy here. I'm just teasing. But thank you, Chair Moser. I just had a question. There seems like there's some confusion about a nurse that is a midwife and the person that's non-nurse midwife, and the consumer gets confused about the level of expectation and the level of medical care they can provide. And so can you elaborate a little bit on the differences and which one has maybe a higher level, and how we can communicate to our consumers that want these services that they're getting the right person for them that fits?
Sure. So there are two types of licensed midwives recognized in Kentucky. One is an APRN, who is a nurse who then pursues additional midwifery education. So they have sort of training in two professions, so to speak. A direct entry midwife, which we title as a certified professional midwife here in Kentucky, is someone who goes directly into the profession of midwifery without first being a nurse. So they both receive midwifery education. It's just that one happens to also be a nurse. In the law that was passed to license the certified professional midwife, part of the disclosure that they are required to give to every client is a description of their education and credentials at the outset of care. It can be very confusing to talk about the different types, but in terms of the care that they receive at a home birth, CPMs are the only type of provider that are specifically trained in the out-of-hospital setting. So we have a few nurse midwives who do also attend home births. They are not trained in home birth. They are trained in hospitals, so they will often go and partner and work under a CPM to learn the ropes of how to work in that environment.
Thank you, Chairwoman.
You're welcome. Representative Dotson.
Yes, thank you, Chair Lady. Just a question. I'm in support of the bill, but cost-wise, having a pregnancy and a birth in a hospital as compared to at home, is there a cost comparison there?
There sure is. I'd like to address that. We did ask for a fiscal note on Senate Bill 89, and the fiscal note came back at about 175,000 from the state and about 300,000 from the federal. If there's a need to transfer potential because they're being paid for by state and federal dollars. But the recognition in my own family, my daughter had a home birth back in October and a home birth 3 years ago. And the difference is about $5,000. So what she paid for her total care in her home birth was about $5,000 less than what she paid in her Christ Hospital bill. That's not always the case, but that's about average.
And I would just add that there's no facility fee in a home birth, so that would be a difference as well.
Yeah.
Okay, thank you. Okay, see no further questions. We will go ahead and take the roll.
Representative Bentley. Yes. Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Representative Rourks.
Yes.
Representative Sharp. Representative Wilner. Representative Whitten. Chair Mosier.
Yes. Okay, Senate Bill 89 passes with favorable expression, and the same should pass on the House floor. Thank you very much for bringing this, and good to see you, Mary Catherine. Thank you. Of course. Okay, next we are going to hear House Bill 764. If Representative Duval and any guests would make your way to the table.
Representative Robert Duvall, District 17, Warren County.
Sarah Cooper, Executive Director of the Office of Legislative and Regulatory Affairs with the Cabinet for Health and Family Services.
And David Lovely, Acting Inspector General at the Cabinet for Health and Family Services.
Okay, thank you for being here. Please proceed.
Chair Moser, members of the committee, thank you for the time to share today. House Bill 764 addresses problematic issues the Office of the Inspector General has encountered as it's implemented the CASPER program, and these changes cannot be accomplished through regulations. Similar language was included in House Bill 290, which passed the House 98-0 in 2023. There's only one difference between last year's bill and this proposal. It addresses the definition of practitioner in Section 2, subsection 40. Other cleanup items in the bill: one, it exempts providers who are engaging in charitable health care services from e-prescribing, which is a very expensive very expensive, so it's going to be a cost savings for them. It requires practitioners to register with CASPER. It gives the authority of the Cabinet to share CASPER data with federal entities involved in military bases particularly, and it actually removes outdated language that does not reflect the current drug schedules.
Okay, we have a motion and a second. Do we have any discussion? Okay, seeing none, DJ, please take the roll.
Representative Bentley. Yes. Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Representative Rourks.
Yes.
Representative Sharp. Representative Wilner. Representative Whitten. Chair Mosier.
Yes. Okay.
Thank you.
Thank you.
House Bill 764 passes with favorable expression. Same should pass on the House floor. Thank you very much.
Thank you.
All right. Okay. Next, I would like to hear House Bill 252. Representative Stalker, just introduce yourself for the record and your guest, and please proceed.
Thank you so much. Good afternoon. My name is Representative Sarah Stalker, and I represent the 34th District.
Good afternoon. I'm Corey Meadows, and I am Director of Advocacy for the Kentucky Medical Association.
Thank you for allowing me to present this important piece of policy. I want to thank the 25 individuals who have already come on as co-sponsors and invite anyone in this committee who hasn't already joined to please see this as an open invitation to co-sponsor. We do have a committee sub.
We have a motion and a second on the sub. All in favor of adopting, please say aye. Any opposed? Okay, thank you.
Sure. Just to be clear, the sub only provides more explicit and clarifying language as to not create any sort of confusion for our doctors. Obviously, my guest here is Corey Meadows. He's with the Kentucky Medical Association, helped with the clarifying language, and is available to answer questions if that's needed. So I just want to start by saying the goal of this bill is twofold. First, it's to protect our patients who might be going underneath surgery that requires an anesthesia. The second is to support our medical students who need to be confident and comfortable giving exams knowing that they have patient's consent prior. We will accomplish this by requiring patients to sign a separate form from the general consent form that they sign prior to going into surgery. And this would allow them to give consent to having an intimate exam for the educational purposes only for med students while they are in that surgery. So in this bill specifically, I hope you notice that intimate consent is covering pelvic, prostate, and rectal exams. It was important to me that if we were going to put this type of legislation before the body, that we cover all of those bases. This bill does have the support of the Kentucky Medical Association, the Kentucky Nurses Association, which you should have a letter of support in your materials, as well as RAIN, who sent a letter of support as well as a one-sheeter. And for anybody who's not aware, RAIN stands for Rape, Abuse, and Incest National Network. They are the nation's largest anti-sexual violence organization, and they created and operated the National Sexual Assault Hotline.
Okay, we have a motion and a second on the bill, and a question from Representative Sharp.
Thank you, Madam Chair. I'm trying to understand this bill. We talked a little bit before the committee hearing started. You're codifying basically an assault happening underneath somebody under anesthesia, correct?
Correct. But to clarify, it's not currently seen right now as an assault. While many people in this room would assume for it to be an assault, historically the medical community has not viewed it as that way. No. So while I appreciate a motion on the bill, and I know the rule is to be quiet and to answer questions, if I could go through just a little bit more material, I think some of the questions that people in this room have could be answered.
Well,
but
if you need to do that to answer the question.
But
ahead.
if my previous response has not sufficed, let me know, and I can continue, and then we can circle back to that as well.
I'm okay with that, Madam Chair.
Okay, all right, thank you.
Wonderful, thank you so much. States are already moving towards this type of policy. We have 25 states that include Texas, Florida, Illinois, Virginia, that have enacting laws requiring explicit consent for intimate exams on a patient under anesthesia. And I'd like to see Kentucky join that group of states. I think it's important to say that the American College of Obstetricians and Gynecologists, many people know this organization is ACOG, they have stated that if exams offer a patient no personal benefit and is performed solely for teaching purposes, it should be performed only with her specific consent. So they have already come out in front of this, and I think that is largely due to the amount of states that are moving to put explicit policy in place to make sure that this practice either does not continue if it is happening in their state, or to prevent it from happening. While the exact numbers, a lot of people have asked me how many people are affected by this. And while those exact numbers are hard to pin down because patients are often unaware, there was a recent study that estimated that more than 3.5 million men and women may have received an unconsented intimate exam within the past 5 years, and that was through the Hastings Center. So another question that I've received from people is, how has this been allowed to happen? It seems very out of step for medical practice. Historically, allowing medical students to perform a pelvic exam, which is an essential skill that students it's been seen as a practical and efficient way just to simply teach them. However, there is really a disconnect between a lot of people within the medical community who see this as normal and non-problematic, and people who are patients, med students, or members of the public who see this as a disturbing violation. PBS did an incredible, maybe it was a 6-minute segment on this issue, and there were some really important pieces that came out of that I just wanted to cite. There was a couple of quotes that I just wanted to pull, that there was, by a young lady said, "There is pressure to perform these exams by our seniors, by our residents, by our attendings, and we are not comfortable